Welcome, everybody, to the Women's Health and Fertility Podcast. Today, I have a special guest, Megan Marie Stewart. Megan is the founder and executive director of the PCOS Awareness Association, and Megan has built one of the largest nonprofits focused on PCOS education and advocacy. Her mission centers on transforming the 7 to 10 year wait for a PCOS diagnosis by leveraging awareness, technology, and provider education, including collaborations with Lujan Labs at Cornell University and Dr. Jill Biden's Women's Health Initiative. Megan also launched the PCOS Con, a national conference empowering women with hormonal health challenges, and leads the Shades of Teal and Men of Teal initiatives, building community and support for both women and men. Her partnerships with leading wellness brands and corporate sponsors further amplify her reach in women's health advocacy. Thank you, Megan, so much for being here today. And I would love for you to just kind of start off by telling us a little bit about your background and how you started in this field and this passion project of PCOS awareness. And
Yeah,
thank you so much for the
absolutely.
work that you do, because it's
No, thank you. You reading that out, I was like, "Ooh, I'm gonna have to talk to my development team because man, they just made it larger than life."
no, I mean you're a very accomplished individual. I think
I
it's spelled
appreciate
out
that.
exactly, and probably you've done so much more too, because I know that like from day to day and week to week, there's so many things that come up for all of
Right,
us, and I'm
right.
sure that there have been many accomplishments since this was given to me several
Well,
months ago.
yeah, absolutely. PCOS AA was started just out of my own need and desire. I myself have polycystic ovarian syndrome, and the struggle that it took to just get, as you kind of stated, like 7 to 10 years is the average of a person with PCOS getting formally diagnosed. So that means you're going
That's
7 years.
unbelievable. Gosh, I
Right,
cannot believe that.
right. So like me myself, I started showing symptoms when I was 9, and I was not formally diagnosed until I was 16. Just I think the just being diagnosed, well, a couple things. Being diagnosed, number one, of course, you can start, street treatments and caring for yourself a little bit better because you're more informed right away. But also it also helps with like I just remember thinking, okay, I'm not crazy. Like, this isn't just in my head. There is something wrong, and now I have a name to it. So the anxiety and the depression that comes behind, like, not knowing like, not being able to put a name to the things that are happening to in your body, in your own
Sure.
skin, is crazy.
Yeah, and in the natural medicine space as a Chinese medicine doctor, I see it quite a bit, or I see the misdiagnosis actually a lot.
Yes.
And it's so unfortunate because oftentimes it's masked by birth control. And
Mm,
for a lot of young women, because they're on birth control since the age of 14, and then to manage, some of the symptoms or the irregular menstrual cycles that they first came in with when they were seeing their gynecologist, and then they just stay on it for 20 years plus.
life.
And then when they're ready to start, trying to have kids or start a family, that's usually oftentimes when the diagnosis comes through. At least when
Right.
in my practice and in my experience is what I see.
Yeah,
So,
no,
yeah.
I think that is definitely something that's across the globe, right?
Hmm.
The masking of it, like you said, I don't know where we came up with this, hand birth control pills out like it's candy on
Hmm.
Halloween when you turn
Yes.
14,
Yeah.
15. Like that's
Agreed.
crazy to
Yeah.
me. Like I was told when I was younger, that, this is the normal thing when it comes to puberty. And then,
Hmm.
yes, here, take these hormonal pills, these birth control pills, and you'll
Right.
be fine. Or
Hmm.
I was also told, like, my mom was told it was in my head and I was faking things just to get out
Oh.
of school,
Mhm.
and was also told that I just needed to lose weight. About half of the women with PCOS gain weight because they have PCOS, and it's not the other way around. You don't get PCOS from the obesity. You're getting the obesity because of PCOS.
Right.
And so losing the weight, I was talking with my co-founder just last night, and it was like I can literally smell a cookie from probably a block away and gain 5 pounds. So
Hmm. For
the
sure.
weight gain is
Yeah.
ridiculous.
And I think when you have like hormonal imbalances, it definitely changes our cravings. I mean, if we could just take a
Mm,
little insight into how we feel during our PMS phase of our cycle. I mean, everyone's hunger peaks and cravings. We reach for the not so healthy foods that we normally wouldn't want to eat. But
chocolate.
yeah, exactly. Sugar, like, potato chips and all the things.
Oh my gosh, you're
So when I
speaking my
think
language right
about
now.
yeah, when I think about PCOS patients and the fluctuation of hormones, like,
Right.
I mean, that's real, and
Right.
yeah.
I was talking to another person just about the simple fact of like, yeah, I can track all the different hormonal imbalances in myself and find what works for me when it comes to losing the weight. But
Hmm.
then let's say, a month or two goes by, I've stopped doing whatever I was doing to lose the weight, and now I've gained it back. But
Hmm.
then now, if I try and go back and I do that exact thing that I did before, it doesn't work because my hormones have changed yet again. So
Yeah, right.
it's a
Yeah.
constant battle of trying to figure out that happy medium of like
Sure.
what works and doesn't work.
Well, let's take a step back for a second.
Yeah.
For those listeners that aren't aware or as informed, what exactly is PCOS, or how would you define PCOS?
Right.
Or polycystic
So
ovarian syndrome?
Right. So the name is deceiving. The name polycystic ovarian syndrome, right? Like when you hear that, you literally think it's just a syndrome that's happening in the ovaries, but it is not. It's a hormonal, metabolic, endocrine disorder, right? It's going to affect women from head to toe. And one of the biggest problems with being diagnosed, with getting diagnosed is the fact that it's going to look different in every single person that has PCOS, right? So I can rattle off a list of the symptoms of some standard
Mhm.
symptoms, but again, like it's gonna be different for every person that has PCOS.
Yeah.
What they do know is that is the number one cause of infertility in women. It does cause the weight gain. It causes added fatigue. When I tell you my energy level is and my fatigue are just half the time I don't even know how I get through the day without like some naps, right? It's also some of the other symptoms, hirsutism. So hirsutism is the added hair growth on the face, neck, chest, back, just any of those places that aren't I guess you would say, as media would say, unwomanly, right? Unfeminine. Had You're gonna get extra hair there. You're also probably going to have thinning on the head. You acne, the way that I like adult acne, I'm like, dang, I sh what I went through through puberty. Why am I dealing with it yet again?
Hmm.
Um, there's also something that they call or they say is like darkening of skin. I actually have myself patches of darkened skin on my thighs. So you're talking like it's like a dark velvety looking skin, right? A lot of people get it under their arms, under their breasts, the back, the neck, anywhere
Hmm.
that you have like creases, right?
Hmm.
Mood changes. My mother will tell you that growing up, my mood changes were insane. Um, Pelvic pain, headaches, you probably sleep apnea, depression and anxiety are huge in PCOS. And I honestly believe that depression and anxiety, it's going to be a vicious cycle, right? Like you feel down and then you're anxious. So, what do they say about depression? Depression is thinking about the past and anxiety is thinking about the future, right? So you're
A
constantly
loop.
in this battle
Yeah.
of
Yes.
depression and anxiety. The ovarian cysts, yes, you can get ovarian cysts on your ovaries. Some people like myself, those cysts rupture, and they could be, at any given time doing an ultrasound, they could be there or they cannot be there.
Hmm.
They call it like the string of pearls
Right.
is that's where they come up with the name PCOS.
So if a person is suspicious that they might have it, what is kind of like the starting place for them to go? What would
Absolutely.
you recommend as first steps to receive
Um,
diagnosis
right.
or the diagnosis, I should say rather.
Right. That's a difficult one because like you were stating, right, people come to you when they're having fertility and they want to use Chinese medicine and you've seen it a lot in your practice. I've heard dermatologists being like, hey, telling their clients or their patients like you're kind of older and you're getting these skin issues, so you probably need to go to see somebody. I would
Mhm.
say, primary care physicians, nurse practitioners, OBGYNs, endocrinologists, dietitians. Those are like you're looking at all of these people that could possibly help you with a diagnosis of PCOS. One of the also things that I definitely like am an advocate for, let's say you do feel like, there's something wrong. You don't know the name of what's happening with you, but you do feel like there's something wrong, and you're going to a doctor and the doctor's blowing you off and telling you, "Yeah, it's nothing," or like you said, take these birth control pills, you'll be fine, or something like that. You have every right in the world to find another medical professional
Yes.
that's going to help you get the answers and, be your advocate for what you're going through.
Mm,
I can't tell you how many times we get the story that a medical professional, again, just like dismissed
sure. Yeah.
their patients. And
Mhm.
I use the analogy often like, what do you do when you go to a restaurant and you get horrible service and the bill comes and they ask you for a tip? Are you going to give them a tip? Probably not as much. The tip might be do better. But at the
Mhm.
same time, like you probably won't give them a full tip and you probably won't go back. Same thing with a medical provider, right? You have all the rights in the world to either not go back or demand second, third, fourth, fifth opinions, right?
Yeah,
I
100%
I would
agree with that.
say,
Mhm.
yeah, I would say that that's probably your first step, just being able to find somebody that can assist you.
And thank you so much for sharing that and also sharing your history and your story too, because I think
Yeah,
it's so helpful in letting other women know that like it's okay to speak up and that some of
oh,
the things
yeah,
that you're feeling are not the norm. And the dismissal is real, and I hear that a lot as well.
yeah,
I was just kind of had this little blip of a download about how I really think like if you have other strong female figures in your life that can help you and advocate for you. I mean, I really think it even starts as far back as that, like a mom, an
yeah,
aunt, a sister that,
absolutely.
maybe have had similar issues, or really, even if they don't themselves have PCOS or hormonal imbalances, to be able to help advocate for you, you know.
Absolutely. That was my mother. For
Mm,
me, it was definitely my mother. We hear that often, and I think that like this generation and going forward generations, right, are getting more boisterous about things. I don't know about, you, but for me, like women's issues in within my family were not spoke about.
mhm.
It was very much like, oh, we don't talk about those things.
Right, right.
It took me my family, like I can't tell you how many times my family comes to me and they're like, Megan, you can't say that on your social media. And I'm like, I bet you I can. I bet you I can.
I love
So,
that. I love how authentic you are. That's amazing and
right.
awesome.
I don't, I feel like if I'm not true to
Mhm.
what's going on with me, how can I sit in this space of advocacy for other women?
Yeah.
It's very important to me. So I will share the ups, downs, lows, highs, ins, outs, all the things that are happening. I think the one picture that I had posted a couple years ago, when I was dealing with some PCOS issues of my own, was like, I literally had went to the OBGYN and they're like, get undressed, and you're getting undressed and you look over and on the table is all the things laid out on the table of like what they're going to do to you that day. I took a picture of those said things and posted it on my Instagram, and my family was like, Megan, that's not very ladylike. And I'm like, well, I wasn't naked. I didn't
Yeah.
show anything of myself. I showed like what's about to happen.
Right,
Like,
right. This is the trajectory of my examination, right? Yeah, no, it's great. We need like real information like that.
yeah.
Well, let me ask you a question. Why do you think that there is this like lag of PCOS awareness, or
Mm.
why is PCOS overlooked so often in the healthcare space?
That's a really good question. And me personally, I strongly believe that it has to do with just the information, right? I mean, you've been to, medical school. I believe the last time I looked, it's literally a page. It's like
Mm,
not even a full page in a medical a book, right? It's a blip. And I feel like we also live in a state of like I had to do some research on my own, right, about this. And it was funny because I was speaking to a lawyer on a podcast, and she literally said that she became a lawyer because she wanted to fight the healthcare system. Only to when
mm,
she became a lawyer and started to research it, she realized the healthcare system is doing exactly what it's supposed to be doing, right? There was nothing for her to fight because she couldn't
mhm.
fight. It's literally there. And when you think about it, like you you're going to the doctor, and most of these doctors are affiliated with a hospital. The hospital set the standards of like they must see 100 patients a day, they must do this, they must do that, and it's not allowing for the personal side of things.
Right,
I
right.
think that they
Like
get so
deeper level
caught up.
conversations and more
Yeah.
comprehensive
Right, right.
intake even.
Right, comprehensive care. It's not allowing for that holistic approach because it's I got to get you in, I got to get you out, right? So I think
Right.
that's a disservice to our community, because PCOS needs that holistic and comprehensive, background and checking on all of the things. That's my
And
belief.
like you said, the symptoms and signs is so different for everybody
Hmm.
that it requires like further questions and
Yeah,
inquiries actually,
absolutely.
and to find out
Absolutely.
more from patients.
And that
So,
feel of just like the medical professional is going to fight for you, right?
yeah,
Again,
yeah. I've
like
got your back. We're gonna get to the bottom of it.
absolutely. I am thankful and grateful and blessed that my OBGYN, yes, when I was diagnosed at 16, she did tell me like, yo, don't, I'll see you and I'll talk to you when you're ready to get pregnant when it
Hmm.
comes to PCOS. That's what
Hmm.
she told me. As my symptoms became, more and more complex for myself, at the time I didn't have health insurance. And I just remember my OBGYN saying to me, well, here's what I can do for you. She was like, I feel bad of everything that you're going through. So I'm going to use you as a case study, and I'm going to write a paper on you.
Okay.
And
Yeah.
then that reduced my medical costs, my medical fees
Mhm.
substantially. So I'm blessed in that aspect, but not everybody has that opportunity to be able to do that.
Right. Well, so tell me more about the PCOS Awareness Association. Like what inspired you to create it, and tell us more about your mission as an
Yeah.
organization.
Yeah, absolutely. So, um, again, my own struggles. I have my mom's friend. She always says to me, "You're so selfless in doing this," and I always have to stop her. And I'm like, "No, no, no, no. This is very selfish of me because I needed it."
Mhm.
When I was like 21, 22, my symptoms were like my cysts were rupturing. I was in so much pain.
Mm,
I was dealing with a lot. There was just a lot going on, and I needed to like figure out what PCOS was myself. And when I was doing research on it, there just wasn't. anything really out there that I could relate to, one, and two, that was actually giving me the support and resources that I needed. And when I say resources, I mean like, okay, yeah, you're telling me to lose weight, or yeah, you're telling me that hair isn't feminine or whatever, but what are you saying to me? Like, what are you doing to help me in these symptoms? So when I created PCOS Awareness Association, I really wanted to like focus on four pillars. Information, support, resources, and the research of PCOS.
Mm,
So everything that we do touches one or all of those aspects of our mission. I don't think we will ever change that mission because we are so deeply rooted in being able to support people with PCOS, and not just people with PCOS, but their support systems too.
mhm,
Like a couple of our programs outside of, supporting people with PCOS is we have a program called Man of Teal.
mhm.
My dad actually created that
I
because
love that.
he, right, he's so funny. He will say like, when you were growing up, I didn't ask you any questions and I didn't ask your mom any questions because it was a woman thing. Like he's
Mhm.
very much like, I don't know nothing about that, and
That's
I
not my
didn't ask.
area.
Right, that's not my area.
Yes.
But as I got older and I created the nonprofit, and then so I'm from Seattle, Washington, and I currently live in Virginia. And I moved to Virginia in 2019. It was the September of 2019, so I hadn't seen my parents in like 7 months after I had moved here. And I'm a huge daddy's girl, and my dad is like my everything. And so I actually had to have, or we did PCOS Con September 20. Oh, no, I'm sorry, not 2019, 2017 is when I moved here. So September of 2017, we did what we were starting off as PCOS Con in Texas that year. And my dad said, I haven't seen my girl. I'm gonna ride my motorcycle from Seattle to Texas. I'll meet you there. I'll attend the event and I'll help you out with the event in any way possible. So
Nice.
he attends that event, and after the event, he said to me, Megan, how come more males aren't involved in PCOS? I'm looking at him like, dude, you told me that you didn't, like,
But you
it
know what?
wasn't.
That's a great question. And I think that men and boys are raised to kind of avoid that whole like
Yes,
menstrual cycle
yes,
realm of a woman's life,
yes,
And so
absolutely.
there's a very much like ooh, that's like a no-no area for us to ask about,
Right,
which I think
right.
the narrative needs to change.
It does.
As
Most
and
definitely.
right? I mean, especially, whether you have siblings, sisters,
Mom,
daughters,
sisters,
right? Like
everything.
aunties and your partners.
Wife.
So why not? You need to be informed so you can understand
Absolutely.
what's happening
Absolutely.
and make sense of it too, because it's a little bit of a
Correct.
roller coaster for the partner too, or the dad,
Oh boy,
or
is
the
it
brother.
ever. Oh boy, is it ever. And that's funny that you say that because we in the past we would join like health fairs, and we would have a booth at health fairs, and teal is the official color of PCOS,
Sure.
and the booth would be decorated in all this teal. We would have like candy or pens or giveaways at the table. I kid you not, all the men that would come to the table just for like, the little free giveaways,
Yeah.
and they would be like,
The
"What's
merch.
this for?" Right? They would be like, "Wait, what's this for?" And the second you say polycystic ovarian syndrome, they would be like, "No, no, no, I don't know, no, no." And we would literally stop
Yeah.
them and be like, "Do you have a mom? Do you have a sister? Do you have
Hmm.
a wife? Do you have, do you have an aunt? Are there women in your life?" And they'd be like, "Yeah, okay, well then you do need to know about this because
Sure.
the prior numbers were 1 in 10, right? 1 in 10 women had PCOS.
Mhm.
More recent numbers in the last couple of years do show 1 in 5. So,
Well,
I mean,
hopefully
women
that
have
means
that.
that the diagnosis process is getting better.
That. Yes. I I wish the numbers weren't going up, but yes, the
But the reality
diagnosis.
of it is a lot of it was probably undiagnosed before.
Yes.
Yeah, so
Yep.
the old numbers of 1 out of 10 was just not like complete data, probably.
Right. Right. Right, absolutely. So, yeah, we absolutely stop them and, give the whole PCOS spiel to them as well. And my dad, like, he really made it a point, in the following year's PCOS con, he actually would host an actual private session with any males that attended PCOS con,
Oh,
where
that's
they would just
amazing.
talk about, yeah, how to better support the women in their lives. We also went a step further and we did partners in teal.
Mhm.
So, significant others, actual significant others of people with PCOS. So we wanted to make sure to include them too and have a special place for them as well. I can only imagine my poor boyfriend, like how he, I don't know how he does it. He's probably like, I wish this girl would just go sit down someplace because
I'm sure that is part of the reason why he's with you. It was because of your passion, a big part. So, well,
right.
let me ask you a little bit more about PCOS Con. So, is it an annual event, and is it always held in Texas?
Yeah, so absolutely. So the official name came out in 2019. So prior to that, we were calling it something else. But I
Mhm.
said, okay, well, we've got Comic-Con, we've got all these other,
Oh,
cons. Let's go ahead and call it PCOS Con. So its official debut in 2019 was a 3-day event in Virginia. Near DC. We started off on the Friday, we ended Sunday at a hotel. We had over 200 participants in that one event. It was absolutely phenomenal. Like the my team laughs at me all the time because before and during events, I will sit there and I'll be like, I'm never doing this again. We are never we're
yeah, it's a
never
lot of work,
doing
I'm
this
sure.
again.
Yeah. Mhm.
But something during events or even, booths that we host and do something during the process always makes me take a step back. And by the end of the event, I'm looking at my team and I'm like, okay, so what are we doing next year? Like,
Well, the
did you just
inspiration
say?
comes through, right? By the ends where you're like, yeah, I could do this again.
Right, right. It's always, there's always that moment of somebody coming up to me and saying, thanking me for the
Mhm.
organization, the information provided, the resources, all those types of things, and that reconfirms my drive. And it fuels me for the next year, right?
Mhm.
So I absolutely love that. But uh let's see. So 2019 it started, and then of course our lovely pandemic hit.
Yes.
And so,
2020.
which actually I will be optimistic and I'll be positive on this. The pandemic hitting actually fueled us
Mhm.
because we went virtual with PCOS Con for 2 years straight.
Wonderful.
And it drove so many more people to being on Zoom and
So
being
more
part of
people
the
can
event.
actually attend,
Yes.
right? Like in
Yes.
terms of like cost, because that could be prohibiting them from actually showing up in
Correct.
person. So, yeah,
Correct.
sounds like that's a silver lining of that time
Yep.
for you guys to be able to reach more people virtually.
Absolutely. And it also helped because like you said, cost for me as well. I
Mhm.
was able to like really button down and be like, okay, well, now let's save for the next when we do come back in person.
Sure.
So we have now stated that we will do PCOS Con in person on odd years, and then even years we're in virtual.
Okay.
So in what was it, 2020? Let's see, 2023, we were in New York, Texas, and LA. And then just this past year,
Three
we did,
spots. Wow.
mhm. Just this past year in 2025, we did New York and LA. So we're hoping in 2027 we bring it to, we're hoping four places in 2027. So
Okay.
fingers crossed.
That's incredible, Megan. So this year is a virtual year.
This year's virtual. Yep.
Okay. And when is it?
So September being the National Awareness Month of PCOS, it's always in September.
Okay, perfect. Great. So we'll stay tuned for that, and hopefully all the listeners will follow you so they'll get all the notifications for that.
Yes. Yes, absolutely.
So, and is anybody invited to that conference, to the
Oh,
PCOS?
please. Yes, we are in the process of trying to get CME credits, so continuing medical education credits to be so that medical providers can attend and get credit for it. That's something that we've been working on for a little bit here. Um, but yes, we ask partners, family members, people with PCOS, medical providers. We would love to see you.
And what kind of topics or speakers are usually part of this event?
Yeah, so the last couple of years, one of the some of the main topics that keep coming up are sleep in PCOS.
Mhm.
A new topic that keeps popping up is menopause and PCOS. We have dietitians that also join us, OBGYNs. I actually think I think the first year we had a couple of endocrinologists attend and give some reports. And then, as you stated, we partner with Lujan Labs out of Cornell University, and
Mhm.
Dr. Lujan and her team normally attend and give a report out of their research that they've been working on.
Oh, that's wonderful. What about on the natural medicine side? Of course, this is a totally biased question.
No,
Do you
no, you're
ever have like functional medicine providers, naturopaths, or Chinese medicine doctors,
yeah.
acupuncturists attend?
So, Dr. Yang, when are you joining us for PCOS Con?
Well, I would be honored to do that, but I'm just curious, in the future,
No,
anytime.
that's
I'm
a
just
really
wondering if that's an area that you also represent at the PCOS con.
yeah.
Because I find that like I've been practicing for over 20 years, and I think a lot of patients come to see us because they are craving and seeking the attention that they're not getting from primary care
Yeah.
or their gynecologists who are, like you mentioned earlier, tied to this formula and these um, what's the word, the parameters or the statistics that they have to keep that are
Right.
mandated by the organization that they belong to, right? Whether
Right.
it's just tough. Like I feel so bad for these physicians because they're like, I have to do my follow-up in 15 minutes, and I have to do my initial almost in that same time, and so they're not allotted a lot of time to get to know their patients. So I think that this is why there's this wave of demand for more holistic care. And so whether it's a
Absolutely.
naturopath, an integrative medical doctor, or a functional medicine provider, or a Chinese medicine doctor, or acupuncturist, we tend to have more time to spend because we're not having to abide by those strict standards and rules of like time limit visits. A lot of us are cash pay practices or out of
Yes.
network insurance
Yes.
providers. So we don't have anybody mandating anything. And so we're able to spend the time. And so I'm really grateful to be able to serve in that way and have patients feel heard because so
Hmm.
many times I can't tell you like how many patients tell me like you're the first person that's actually listened to me
Mm,
and to
it's
to hear
heartbreaking.
me out all of the things that I've gone through since I was a teenager. And exactly what you said earlier, I started thinking I was crazy, or
Yeah.
my providers started to make me feel like I was crazy,
Yeah. Yeah.
wanted to put me on antidepressants and
Hmm.
anti-anxiety meds. And I
Hmm.
knew that wasn't going to solve anything for me, and I hear that a lot. So, anyways, I'm just kind of going off on a little bit of a tangent, but wanted to ask you about that and how you see this fitting into um, this this PCOS awareness plan. And I
Yeah.
hope that it's something that you're interested in and would love
100%.
to share more resources with you because although most of my
I would love that.
resources are in California, but I just am
No.
really excited about being able to spread the awareness and I'm just really grateful for the organization that you created, Megan. And so, however, we can disseminate more information and more support for patients, I am a huge, 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 huge advocate for that. And
Yeah, 100%. So me personally, I actually used women's health acupuncturist. And
wonderful.
she regulated, helped me regulate my periods. I'm no longer on birth control pills and they come like clockwork. So I can't, and that was like 11 years ago.
Oh, wow.
So for me to be still like clockwork, I can count. My phone counts for me, but
That's
on my
awesome. That's
calendar,
so
it just
fantastic.
still
I'm so happy to
comes.
hear that, Megan, that you
Yeah.
were able to get your rhythm back for
Yep.
your cycles.
Yep.
Yeah.
Absolutely. I will oftentimes recommend it to people. I haven't been able to find one here in Virginia, it's particularly a women's health acupuncturist because I
Can help you with
did
that.
see. Ooh, I like
Yeah,
this.
no, we
Okay.
have some associations that,
Right.
and I'll just mention it actually even now. The American Board of Oriental Reproductive Medicine, aborum.org. I don't know if you've heard of our organization, but it's a group of acupuncturists. We have a fellowship. So we've all done extra training in women's health and reproductive medicine.
I love it.
And so, although it's a national, actually, it's an international group. But that's one of
Mm,
the best places to go when you're looking
okay.
for a women's health specialist or a fertility specialist. Um, I highly recommend that. So whenever patients ask, like, "Hey, can you recommend an acupuncturist for my friend or my sister? She lives in a different state."
Nice.
I always send them to that website. So you
Okay.
can do a search in the directory and you can put in like the city that you live in, and it'll
Great.
try to find like a certain mile radius of acupuncturists that are ABORM certified.
Okay.
So
Most
that's where I
definitely.
would
Thank you for
start
that.
for you.
Thank you.
And
Because yes, I went to one and I was like, ooh, this is not it.
yes, you were like, I know how women's health acupuncture should be.
Like
Mhm.
this is not it.
Yeah, and I know sometimes it takes a little while to find the right fit and the right match for
It
sure.
does. Right. Right. Just like with anything else, right?
Yeah, get a second or third opinion. Yes, for
I'm
sure.
notorious for that.
I love that though. You keep searching until you feel that the alignment is there.
Correct. Comfortable. Yeah. You want to be able to speak to, openly speak to your provider.
Hmm. Yeah, and hopefully that they're actually listening and taking into consideration, the entire intake conversation into whatever treatment plan they put together for you.
Right.
The last thing you want is for it to seem like it's what's the word I'm looking for? Just kind of rote, just
What's
there's
that?
very, acupuncture is a very intimate medicine and it's a
Yes.
very uh, spiritual medicine too. And I think that sometimes when it's practiced more like technician style, that's
Mm,
not really the way it was meant to be practiced.
right.
And I think it could be really, it can still be effective when practiced in that style too, but not for women's health. So I'm going to go out
Right.
on a limb and say that because
No,
I
no,
just think that when you're
I,
taking care of women, it's a whole nother level of treatment, and you really have to treat the body, mind, soul of the person. And
absolutely.
yeah, the technician style is not going to fly.
Right. Right.
So yeah,
Right.
I'm glad and I hope that you find someone that's a good fit for you, Megan.
Thank you. I'm gonna definitely check out that website that you mentioned. 'Cause
Yes.
yes, it's time. It's time to get back into it.
Mhm.
Just for other women's health. Again, my cycle is on par.
Still on track. I'm glad to hear that.
It's on par.
That's
I
awesome.
love it. I love it and I hate it all at the same time. I'm like,
Yes,
why
yes.
did I do that?
You're like, now it's every 28 or 30 days.
Right.
And
I'm
yeah. But
like,
at least you can
who
plan your
signed up
life
for that?
a little bit better, right? Knowing
True, true.
like this
Well,
is where
before
I
it
put
wasn't
things
coming
in.
at all, so most definitely my mom will joke and laugh and she'll be like, "Yeah, you were just, you were stopped up. You were backed up. That's what your problem was." I was like, I don't think that's the way that works.
Oh, you mean like you have like this reserve of periods to have?
Right.
Oh my gosh. Boy, I sure hope that's not the case because then you'll be having like multiple periods in a month if
I
that
did
were
that.
right.
That well, so my first one, when I was 16, when I was formally diagnosed with PCOS, I still hadn't had a cycle, and
Okay.
they actually put me on progesterone, and my first one lasted 3 months.
Oh goodness. And they let you have a period for that long?
They did, and I was traveling. So we're originally from Boston, so my grandmother I think was sick, and so we were like back and forth from Boston to Seattle in that 3 months, and going up in altitude makes it worse. So it
Oh
was
my goodness.
horrible.
Well, hopefully that didn't leave you anemic or
Oh, it did.
it
My
did.
iron levels are, yeah.
Okay.
I'd have an iron transfusion a couple years later, so yeah.
Okay. Yeah, that's inevitable. That's a long time of bleeding.
Yeah, it was. It was ridiculous. But like I said, now it's comes and goes when it's supposed to.
Okay. Predictability is a good thing.
It is. It
Yeah.
is.
Well, so tell me a little bit more um about the PCOS Awareness Association, the direction it's going in, and some of the goals that you guys have for 2026.
Right. So 2026, I'm in talking with my board and my leaders, it's really a year of growth, right? It's a year of let's button down some hatches because in the past we've had a lot of programs, but not anybody to really follow through on them, lead them, direct them, that kind of thing. So they've kind of fallen off. We had a program that we were calling the ambassador program, and really that was to allow us to help people in any state, city, whatever, to kind of create their own little support groups, right?
Okay.
Sanctuaries, PCOS sanctuary support groups, and have meetups, have we were also supplying them with supplies to be able to attend health fairs, all of that kind of stuff. And that program was really difficult to manage. So now we're kind of revamping it. And we're going to call it the Teal Impact Core. And so there'll be three kind of tiers to that program. So that'll be opening up here soon. Another thing that we really wanted to focus on this year is the advocacy portion, not just advocate between you and me or anybody else in the PCOS community, but advocate on the legislation side of the
Okay.
house, right?
Mm.
So our website is currently in the background. It's being revamped, and we will be releasing when it gets released out again. There'll be a page to be able to kind of put your name and your location into a form, and out of the form will pop a generated letter, already generated letter to your locality's governor or whatever's local in your area, that you can then print and mail off for PCOS advocacy.
Okay.
I'm excited about that letter because that is one thing that we've been trying to work on. We actually partner with Congresswoman Spice out of New Jersey, and she is working on like menstrual awareness in her location, and so in reproductive health. And so like she had us on a bill where it was giving back a little bit of what would you call it? Like not time, but giving some grace to people with PCOS when you coming to like school. I don't know how
Yeah.
many times that I missed
Mm.
class and was marked truant and or absent because my cycle was horrible, my PCOS symptoms were horrible, and I just remember always having to bring a note in for my mom. Well, we're asking that schools, educational systems are giving a little grace to people that are going through, not just people with PCOS, but just in general, like women that are going through some menstrual equity rate issues, right?
Absolutely. Well, I mean, there's
Um,
so many different things, right? It could be endometriosis, it could be, I
yes,
don't know,
right,
meiosis. There's so many things.
right.
I love that.
So,
That's
yep,
going to be amazing for women and
yeah,
young students too, because that's the part where you're just like, I'm not able
I
to
can't move.
I can yeah, I can't
I
make
can't
it.
move.
And yeah, I need some like give me some like work from home um
Right.
leeway that I
Yep,
can yeah,
absolutely.
that's incredible. And what about the other resources on your website? Like where can women go for more information about
Absolutely.
PCOS and maybe local resources for them?
So we are actually working on the local thing as well. That's one of the
Okay,
things. So we used
cool.
to have a search engine on our website that allowed you to type in kind of like what you were talking about for
State
the
board website.
organization that you're a part of, where you type in your like zip code and it gives you within, a 10-20 mile radius, it gives you actual medical professionals. This side was medical, actual, um what would you call it? Insurance-based medical
Like
professionals.
gynecologists and
Yeah,
primary
unfortunately,
care.
I would love to have it be for all sort of practices,
Sure.
but the data is literally coming from the insurance companies on that
That's
ICD-10
okay. I mean,
codes.
data is still good data to be able
Yeah,
to, sort of like streamline the information so that
right.
patients could at least go through the list and decide, like, maybe I want to interview a couple of these doctors, see if they're a little
Absolutely.
fit. Hmm.
Absolutely. And the mission behind, well, yes, that's part of the mission behind that. And second part of the mission is getting that diagnosis time cut down. Like if
Yes,
you're
please.
going to if you're going to somebody who has seen somebody who has PCOS, you're more than likely going to be diagnosed quicker,
For
right? So
sure.
that's the thought process behind that. Um, some other things that we are doing as well on our website. Yes, we do partner with a ton of different resources. Um, I'm not a mental health specialist, but the way that we get messages into our social media and our inboxes, our email inboxes, asking for assistance is it's heartbreaking to me. So I'm not about reinventing the wheel. My thought process is if there's something out there already, then let's guide people towards that, right? So we actually partner with the crisis text line. So like if somebody is dealing with a mental health scenario when it comes to PCOS, if they text PCOS to 741-741, they will get somebody on the other line that is, qualified because I am not qualified.
Okay. Well, that's a huge help, though.
Yeah.
What a great
Yeah.
resource. Okay, that's good to know.
Um, some other resources that we've partnered with what's it called? Just Answer. So if you on our website, there's a section where you can type in a question. It'll automatically connect you with a medical provider that can answer that question for a small fee, of course.
Mhm.
Some other things that we have partnered with, well, prior years, our corporate sponsor was Milan Laser Hair Removal.
Mhm.
We also, our thing is we're going to give all the information for for anybody to make an informed decision for themselves, right? So we've done laser hair, we've done hair removal, we've done electrology hair removal, we've done waxing, all the different options when it comes to the hirsutism. We've
Mhm.
provided that information. And again, it's up to the person to kind of make an informed decision for themselves, what works for them. Um, we also have let's see, our one of our longest going partners has been Needy Meds. Needy Meds across the US, they have like almost 13,000 clinics, and those clinics are low cost, sliding scale and or free clinics. And in each one of their clinics, they do offer information, like our pamphlets in their clinics about PCOS. And they also gave us a medical drug discount card, which I actually tested myself. And back when I was taking birth control pills, I did, I had insurance. I think I was paying something like $5 a month for my birth control pills, but I tried using their card instead, and I think it was like 5 cents. I paid five
Wow.
cents.
Okay.
So,
What a
yeah.
helpful resource. That's incredible.
Yeah,
Thank you
yeah,
for
because we
sharing all of
definitely
that.
have, oh, thank you. We definitely have realized that a lot of women that in our community are, low income. And so we want to be able to make sure that we're providing those resources that are affordable for them as well.
Yeah, and make sure that they can have access to it too. Well, wow, this has been such a great conversation. I do want to ask you,
Yeah.
um, do you have a final message or any words of wisdom that you would like to share?
I think so. I always teeter on two, which we already discussed one, you being your own advocate, right? My other one is grace, right? Giving yourself grace. I don't know how many times growing up, from age 9 when I started showing symptoms to probably just maybe 10 years ago, I was not giving myself grace. And the way that I beat myself up when it came to PCOS was more damaging than anything, right? More damaging for myself and my family than anything, right? The pressure I put on myself, as in this, like I can't look like this, I can't do this, I can't do that, right? Just giving yourself grace, and in the space of for those that are dealing battling with their weight, like, okay, I had a bad day. I had more cookies than I probably should have today. But tomorrow, I promise myself I'm going to do better, but I'm giving myself that grace, allowing myself today to be like, I've had it. Today's been a bad day. Next day, we're going to have a better day. So,
Yes, I love that. That's a wonderful message. And I think it's also about self-love.
yeah, yeah,
Embrace and love yourself.
right.
And because when we self-talk and if we have negative self-talk, that is the absolute opposite of self-love. And it's
Absolutely.
going to do more harm than good. So,
Right.
yeah, I love that. I love that message. Um, Megan, anything else you want to share with us before we wrap up?
No, but I really do hope to see you at PCOS Con.
Yes, no, I
Your
am. What
viewers.
city is it going to be in, or what are the cities coming up?
Right. So we are talking LA again. So we would definitely
Okay,
want
if
to
it's
have
in
you in
LA,
LA.
then it's meant to be.
Okay.
All right. Thank you so much, Megan, for your time. I really appreciate you being on my
Thank you.
podcast and sharing all the amazing work that you do and the gifts that you're sharing with the PCOS community. So, thank
Thank
you.
you.
I am looking forward to seeing your revamped website with
Yeah.
all that it's going to have to offer.
Ooh.
So.
I've been working on it and it's been a tough one, that's for sure.
Well, I mean, it sounds like you're doing a lot, so I understand. I completely understand why, but I think when it's done, it's going to be
Oh yeah,
incredible.
it'll be
So,
a great hub.
yeah,
Yeah.
awesome. All right. Well, thanks again for your time.
Thank you.